Hey everybody, welcome back to my YouTube channel. If you've been told you have a deviated septum, or if you have spent your entire life breathing through only one side of your nose, then this video is for you. We're going to go through what a deviated septum is, how it is diagnosed, and how it is treated with this septoplasty. So stick around to the end. This is going to be really helpful answering all of these burning questions that you've been Googling into the midnight hours. If you are new to this channel, my name is Ashley Agan, and I am an ear, nose, and throat doctor. I perform septoplasty surgery all the time. It's one of the most common surgeries that I do. And we're going to go through some of the most common questions that patients have. So first, starting off, what is a deviated septum? So the septum is the bone and cartilage that separates your nose into the right half and the left half. So it's just like a wall that's kind of going right down the middle part of your nasal cavity, going this way, okay? So it's kind of cartilage in the front and then transitions to bone. A deviated septum means that that septum, rather than being a straight wall, has some crookedness to it. So imagine that kind of appearance where the septum is more crooked towards one side. And the reason that matters is that that can make it more narrow on one side of the nose than the other. So what patients will experience is sometimes they'll tell me, I've never been able to breathe through the left side of my nose. Or if my allergies kick up or if I have a cold, my nose just swells completely shut and I can't breathe. So these are kind of the things that patients will feel. Usually if it's just purely a deviated septum, the outside of the nose will not look particularly different because these are the nasal bones right here. So this is different than the nasal septum, which is running through the middle part of the nose. So most patients will not have the knowledge that they have a deviated septum unless someone has looked inside the nose. Okay. So what is septoplasty? So in pure septoplasty surgery, we're removing that crooked part of the nose so that it is a straight wall. So again, we're working inside the nose and not changing the appearance of the outside of the nose. So these nasal bones here are not changed during septoplasty surgery. Everything is inside the nose, making that wall straight so that it is not crooked towards one side, which will allow patients to be able to breathe through their nose much better, breathe through both sides of the nose, restoring that proper airflow. One of the most common questions that I get for this are, will it change the way my nose looks? And generally the answer to that is no. So when people think about nasal surgery, they think about a nose job. They think about what we call rhinoplasty surgery. And that's when, you are changing the nasal bones here. You might be changing the tip, adjusting these cartilages here. And that's kind of the external framework of the nose. And I commonly tell patients, when we think about the nose, we just think of what we see, almost like a Mr. Potato Head doll where the nose is just stuff right on there. But in actuality, the nose is the nasal cavity, which extends all the way back to about here. So if you look inside your mouth, how far your palate goes back, the palate is the roof of your mouth, but it is also on the top side of that, it's the floor of your nose. So that's how deep your nasal cavity goes back. And so when we're doing septoplasty surgery, we are working on the septum inside your nose, working back and not needing to change the external appearance of the nose, because technically that is called a rhinoplasty. We're changing the way it looks outside the nose. So typically I would not expect for straightforward septoplasty to change your nose in any way, shape, or form. Okay. How long is recovery? So this piece of it, I think, is what prevents a lot of people from going forward with surgery, because they're just worried about how much time they're going to have to take out and how long they're going to feel bad. So I encourage patients to take a couple of weeks off. I would say most people take a week. And if you are doing some sort of like desk job or light work where you're not having to lift anything heavy, most people can return to that within maybe 5 days, 5 to 7 days. Again, it depends on exactly how extensive your surgery was, how if you're in pain and you're needing to take pain medications like narcotics. Obviously, if you're taking a narcotic, you can't drive, you can't really do any sort of job that would require like clear decision making. But in general, the nose is going to feel really stuffy afterwards because everything's going to get very swollen. And so there will be more nasal obstruction and mouth breathing immediately after surgery. So should be expected. The next most common question is it painful? And I would say the first 48 to 72 hours are the hardest for patients. It feels like you have a really bad cold. Sometimes patients will report like pressure or headache. The pain medication that we prescribe is usually sufficient for that. I think patients who are sensitive to taking narcotics, who prefer not to take narcotics, may need a special pain medication regimen to be able to kind of get over that hump for the first 2 to 3 days. But I would say, in general, expect at least some moderate level of pain and discomfort that is worse in those first 2 to 3 days. Beyond that, the most common complaint that I hear is just that it just feels so stuffy. My nose feels so stopped up. Mouth breathing, which is uncomfortable. Think about when you have a really bad cold and you're trying to sleep and your mouth breathing and your mouth gets dry. It's kind of that. So I say expect to feel like you have a really bad cold for the first few days, maybe even that first week. And then it will be downhill from there. Will I have nasal packing? So when I learned how to do septoplasty surgery, I placed what's called Doyle splints, which are these plastic or silicone splints that are placed inside the nose this way. And I don't do that anymore. I now use a dissolvable form of packing. So when it goes into the nose, it kind of looks like cotton. And then patients will use saline spray after surgery, which helps dissolve that. And if there's any left over when I see them 2 weeks out, then I'll just suction it away. And in my experience, the dissolvable packing is a lot more comfortable than the Doyle splints. And so that's why I have moved to using dissolvable packing exclusively. But the packing is helpful because it helps prevent bleeding and it helps prevent scarring. So those are my 2 biggest reasons why I like to at least have some of it. Let's talk about risks of surgery. So in general, any surgery is going to have risks of bleeding, infection, scarring, just inherent to just about any surgery we do, right? And then in addition to that, with septoplasty surgery, septal perforation is a risk as well. Septal perforation is where there is a hole through the septum connecting the right side and the left side. So when we do septoplasty surgery, we lift up the lining off of the septum. So the inside of the nose is lined by mucosa. So we lift up that mucosa so that we're just seeing the bone and cartilage. We remove that crooked bone and cartilage, and then we put that mucosa back down and it heals together. If it fails to heal together, you can have a hole connecting the right side to the left side. The risk of that is low, less than 5%. And the need to do anything about that septal perforation depends a lot on where it is, how big it is, if it's causing any problems. Some patients can have a septal perforation and it doesn't, they have no idea it's there. Some patients can have whistling, they can have crusting or bleeding, and so it really just depends. The bigger things that I worry about personally are bleeding and scarring. And so the bleeding risk is around 1 to 4%, and it is highest in the first week after surgery. I tell patients expect a little bit of like bloody drainage or slow bleeding right after surgery. And but if blood is pouring out, that is not normal, and they should call me. Very rarely, if there is bleeding after surgery, I might need to put some additional packing in. Very, very rarely, we might actually have to go back to the operating room to find where the bleeding is happening to stop it. Again, that's very rare, but because of that, I usually ask patients to refrain from significant travel during those first couple of weeks, meaning I don't want them to be like on a camping trip in the middle of nowhere, a week or even 2 weeks after surgery, because if there is a nosebleed, then they're kind of out there on their own without being close to me so that can help stop it. That risk is low, again, less than 5%, but it exists. And then with scarring, the packing that I use after surgery in general prevents scarring from happening. I will usually, when I see patients at that 2-week mark after surgery, usually I will look inside the nose. And if a scar is starting to develop, then it is usually soft enough that I can kind of remove it and prevent from becoming a mature scar before that becomes a problem. Because the goal of septoplasty surgery is to help patients breathe better. And if a scar forms, usually it's across, meaning like from the septum to the turbinate, the lateral wall. So scarring generally is against what we're trying to do. It will tend to narrow the nasal, whereas we're trying to create more room so the patients can breathe, right? Okay. How do I know if I'm a candidate for septoplasty surgery? So for this, the big thing is the exam and the symptoms. So the typical encounter when I'm seeing patients in the office for this, patient will come in and they will tell me, I have a lot of nasal obstruction. It's really hard to breathe through my nose. Maybe I've never been able to breathe very well through the right side of the nose. Maybe I have some allergies. We kind of talk about all these things. And then we do what's called nasal endoscopy, where we look inside the nose and with a little camera, record it, and then we look back over it together. And then we can kind of see, okay, is this structural deformity, that deviated septum, is that contributing to the symptoms you are experiencing? And when I'm talking about any sort of issue with the nasal cavity, I always tell patients there are 2 pieces to nasal obstruction. There is the anatomy, meaning bone and the cartilage. That is the way it is. You may have developed that way. You may have had some trauma to your nose that made it crooked that way, but that's no amount of medication or nasal sprays is going to fix an anatomy problem, right? These are things that we use surgery to correct. So if there's a significantly deviated septum, surgery is just about the only thing that's going to fix it, right? And then the other piece of it is the lining of the nose, which we call mucosa. And mucosa is dynamic, meaning it changes every day, all the time. If you have allergies and you are allergic to tree pollen, then in the spring, that lining of the nose might become swollen, inflamed. It might secrete more mucus. And so that piece of it is going to be treated with medications. So even if we correct your septum and your septum is completely straight, if there is ongoing mucosal hyperreactivity, meaning that the mucosa is swollen and you have allergies and it's making mucus and it's blocking up your nose, if we ignore that piece in it, you will have ongoing issues with nasal obstruction. So we have to think about both. Some people have a purely deviated nasal septum, no allergies. We fix the septum, they breathe great, they're on their way. Some patients have purely an allergy problem and we manage their allergies and they're on their way. A lot of people have both. And so it is deciding where do we want to focus our energies? And sometimes it's a little bit of both. Sometimes when we create more space in the nose by doing a septoplasty, then their allergies are easier to manage because their nose doesn't swell completely shut just because there's a little bit of allergy inflammation. So a lot of times it's a 2-tier approach, and they may still need to take a little bit of allergy medication to be able to feel 100%. Hopefully that makes sense. Okay. So as far as, results long-term, what to expect, I will say these are some of my happiest patients. And most of them will tell me that they are super apprehensive about having surgery. They get through those first couple of weeks, which they admit is a bit of a rough recovery. Again, like having a cold, a lot of mouth breathing, a lot of nasal obstruction and swelling. But then as that goes down and they start to be able to breathe through their nose, especially if they've never been able to breathe through one side, then they just are, they have this awareness, this totally new experience of being able to breathe that many of them have never had before. And it's really cool because they're usually really excited about that improvement in their quality of life, that they didn't even really realize what was on the other side of it, because they just had gotten used to this, normal of nasal obstruction and mouth breathing and poor sleep and poor exercise tolerance and all these things. And so suddenly being able to breathe through their nose for the first time in their life, then they notice, oh, wow, all these other things happen as a consequence of it. And it's super exciting to get to witness. Okay, so if you have been living with these types of symptoms, if this sounds like you, if this resonates, then I'd really like to be able to help you out with that. The steps forward would be taking a look inside your nose, seeing what's going on. Is there a deviated septum? Is there something else? Are there nasal polyps? Is there chronic sinusitis? Is there something else going on? But figuring out what is the root cause of this and then developing a plan to help you breathe better is the way forward. And if you would like to team up, I would love to be on your team to help you breathe better. My practice is in Dallas, Texas. It's called Scotty. It's named after my grandmother. That was her name. And you could go to scottyent.com, book a consult. We'll get you in. We'll take a look. We'll figure out a plan to help you breathe better. If this video was helpful, I'd love for you to do me a favor and go ahead and hit the like button. Share it with someone who has a deviated septum or has these questions, and subscribe to my channel for more ear, nose, and throat related content. Drop comments below if you have any questions. I'd be happy to make more videos going into more specific details about septoplasty, because it is so common, and I feel like I spend a lot of time counseling patients about when the right time to proceed with septoplasty is and where that step fits into their overall journey to help them breathe better through their nose. So I hope you enjoyed this video. I will see you in the next one. Thanks.